Welcome everyone to the 7th and final webinar in our series, What the COVID-19 Pandemic Means for Refugees. If you're participating, make sure that your mic is on mute. Please also note that we're recording the webinar for those who cannot be with us synchronously. All our webinar recordings can be found on our YouTube channel, and we're going to post the link in the chat, probably right now at the beginning, and we'll also post the link again at the end. I'm Galia Benarye, and this series is part of the new Colloquium on Refugees, Migrants, and Statelessness. That is one of the working groups within the Northwestern Weinberg College of Arts and Sciences Center for International and Area Studies. The Colloquium is the new generation of the Center for Forced Migration Studies and works to broaden our understandings of the realities of refugee flows, asylum seekers, conditions of statelessness, internally displaced peoples, and development climate-induced migration. My co-host for the series has been Deniz Duriz. She's a sociocultural anthropologist working with migrant farm workers from the Kurdish region of Turkey and Syrian refugees in Turkey and in Europe. She's currently a Northwestern postdoctoral fellow of the Cayman Modern Turkish Studies program housed under the Buffett Institute for Global Affairs. The webinar series is made possible through the assistance of Danny Postel, who's the Assistant Director of the Center for International and Area Studies, and Cindy Pingree, who provides administrative support to our faculty research groups. While those of us in the United States in our homes or with loved ones wish we didn't have to be participating in this global-wide stay-at-home order, millions of refugees around the globe have no home and live in crowded, open camps, detention centers, and makeshift urban tent cities without access to clean or running water and in crowded living conditions. Refugees who imagined that once they made it to the United States and Europe would find protection are now finding that COVID-19 has enabled even more repressive border controls and arbitrary government policies that deny them access to welfare at this critical time and restrict family reunification while relying on their labor in factories and nursing homes where they face greater risks of exposure to the deadly pandemic. Throughout this series, our hope has been to raise community awareness by bringing you speakers from the front lines, advocates, practitioners, and refugees who can fill you in on their situation. Prior webinars brought information about the front lines in Greece, continuing work of UNRWA and Palestinians in East Jerusalem, refugee advocacy in Chicago, remote social support for refugees in Canada, and refugee trends and everyday lives in a metropolis focused on Istanbul. Today is the final webinar in the series. Our focus today is on Europe, European Union, and in particular, Poland. An article this week in Crisis magazine highlights a letter 60 concerned migration scholars sent to the President of the European Commission, Ursula von der Leyen. Their motivation was the urgent need for the EU and individual member states to change the inhumane and violent measures that migrants and refugees were being forced to endure as the COVID-19 pandemic unfolded. The letter calls for immediate action and radical revisions of current EU policies on mobility and migration governance, and all its signatories had experience working on projects funded directly by the European Commission, like some of our speakers today. These projects have been aimed at improving migration governance, border crossing, and the treatment of asylum seekers and refugees in the European Union. In the last 2 days following the submission, the letter was signed by an additional 300 academic researchers wishing to join the call. It seems that the European Union funds extensive academic research with the potential to inform humane and effective border policies, yet evidence-based immigration policy is undermined by the EU's increasingly repressive border regime. So how do we make sense of this contradiction? Hopefully today we'll get to this a little bit in our moderated discussion. Today's webinar, we have 2 speakers. We have Dr. Katarzyna Himak, who will introduce the International Research Project, NIEM, and Ksenia Homel, who will tell us more about the situation in Poland during the lockdown and the ways in which the NIEM project has been monitoring the impact of coronavirus on asylum seekers and beneficiaries of international protection, including the socioeconomic situation of migrants and the difficulties they face in Poland. The format for today includes 7-minute introductions by our speakers. I will then moderate a conversation with them, and then we'll open up the forum for the Q&A from our participants. So please, participants, post your questions in the Zoom chat. My co-host Deniz will be monitoring the chat to collect your questions for the Q&A. Before turning it over to our speakers for their introductions, I want to just give you a little bit about their bios. We're very happy to have you here with us today. So, Dr. Katarzyna Himak is a historian, translator, social activist, one of the founders and member of the board of For Free Russia. This is an association founded in Warsaw in 2015. The association aims to promote dialogue between civil society in Russia and Poland. She has a master's degree in European history and has also had a fellowship at the Konrad Adenauer Foundation and the Leibniz Institute for European History in Mainz. From 2011 to 2014, she worked as a research assistant at the German Historic Institute in Warsaw, and she's currently affiliated with the Warsaw-based think tank, the Institute for Policy Affairs. Since January 2020, she's the head of the IPA's European and Migration Policy Program. Welcome. I'm happy to have you here today. With us here today is also Ksenia Hamel. She's the Project NEAM's National Advocacy Officer. NEAM is part of the European and Migration Policy Program at the Institute of Public Affairs. She's a PhD student of sociology at the Institute for Applied Social Science at the University of Warsaw and graduated with a Master of Criminology and a Master of International Relations from the University of Warsaw. So she is with us here today. So I'll turn it over now, and if you want to share your screen with your PowerPoint, you may do so. And I believe that you're going to be starting, Katarzyna, so take it away. Thank you.
Yes, thank you very much for this nice introduction, and thank you for providing key actors in integration field with evidence-based comparative analysis of integration policies in place in 14 EU countries, and thus to prepare them to better face the current challenges, improve the integration outcomes of beneficiaries of international protection. It has established a mechanism for biennial comprehensive evaluation of integration policies of beneficiaries of international protection, and providing evidence on gaps, integration standards, identifying promising practices, and evaluating the effects of legislative and policy changes. NEAM its project started in 2016. It includes 3 rounds of research, baseline, baseline research, evaluation 1 and 2. Our main source of funding is the Asylum, Migration, Integration Fund of the European Union. Project has also several strategic partners, Ministry of Family, Labor and Social Policy of Poland, Ministry of the Interior and Administration of Poland, UNHCR regional representation for Central Europe with a seat in Budapest, UNHCR representation in Poland, and University of Warsaw. The leader of the project is the Institute of Public Affairs, already mentioned. So the institute, both me and Ksenia are affiliated with the seat in Warsaw, and the project also has a research coordinator based in Belgium. This is Migration Policy Group. Now I would like to ask Ksenia to move to another slide. Here you can see a map presenting the scope of the project. You have a list of organizations and institutions included in the project. The only change I would like to mention is that Portugal is unfortunately no longer included because our Portuguese partner has decided to leave the project, but still we have 14 countries in which we analyze integration policies, and Belgium, which is where the research coordinator is based. So apart from Belgium and Portugal, these are all these countries marked with blue, including Poland, of course. Now we can move to another slide. As I said, NIEM is based on regular indicator-based monitoring of the quality of government policies, of integration of beneficiaries of international protection in 14 EU countries. We have 13 areas of integration, including reception. And these areas include, for example, general conditions, impact of reception on integration, mainstreaming on integration, governments, legal integration, access to housing, employment, health. You will see a list of all these areas in a moment. And we also have 173 indicators to measure these policies and developments in all countries included in the project. Now we can move to another slide. Yeah, so here you have the list of all these areas to measure integration. Another slide. And this, yeah, as I said, NIEM tries to establish a mechanism for comprehensive evaluation of integration, provide evidence on gaps in integration standards, identify promising practices, and evaluate the effects of legislative and policy changes. We already concluded 2 rounds of research out of 3. In 2019, we published a report from research conducted in 2017. This report is available on our webpage for integration.eu. I'm sure that Ksenia later will give you this website address once again, and probably late June this year or July we'll publish a report from the 2nd round of research, and in the next report planned for next year we plan to include also the monitoring of the situation of beneficiaries of international protection, the impact of coronavirus on their integration. This is something, of course, unforeseen initially, but immediately after the measures to counteract the spread of pandemic were introduced, we decided that we need to monitor the situation and to also include this situation in our analysis. So I would now like to give the floor to Ksenia, who will tell you more about our findings concerning Poland. Thank you very much.
Thank you, Gaia, for introduction and invitation to the webinar. I'm very glad that in such demanding times we can discuss such an important issue as situation of forced migrants in Poland. And also many thanks to Katarzyna for introducing the project NIEM. I think in few minutes I will briefly present an overview of asylum situation, asylum system in Poland. And then I will focus on COVID-19 and its impact on governmental measures on asylum seekers and people with granted protection in Poland. So very briefly, the legal framework in the field of asylum system includes national, European and international legislation. I will just briefly focus on 2 national legal and institutional framework. There are a few forms of protection, as you see in Poland, which are introduced by the law on protection, the first one, and the law on foreigners. There are 3 forms of international protection: refugee status, subsidiary protection, and temporary protection, and also 3 forms of national. First of all, asylum, which can be a bit confusing comparing to European system. And 2 forms that are regulated by the law on foreigners: permits for stay due to humanitarian reason and permits for tolerated stay. Actually, these last 2 forms are most popular in Poland, but actually these forms are less favorable in terms of social security and access to public benefits, comparing to forms of international protections as refugee status or subsidiary protection. If we look at statistics, beneficiaries of international protection present a rather numerically small group in Poland. But if we see the latest data from the Office for Foreigners in 2020, people who obtained the statuses of national or international protection, we see that the group, actually it's here, who has residence due to the humanitarian reasons prevail. That's why we cannot omit this group when discussing the impact of anti-crisis measurements the Polish government recently implemented. A few words maybe about where do asylum applicants came from, because here we also have some differences than the general situation in European Union, because we should take into consideration the geographical and strategic location of Poland. Poland has its external border, this is the external European border with Belarus, Russian Federation and Ukraine. That's why we see among all groups as applicants and also refugees, subsidiary protection and humanitarian state, we see the majority are people with Russian citizenship. The second largest group are citizens from Ukraine. Only in the category of refugees, we see the extent group of Syrians, who are actually also have the highest rate of recognition rate in all European Union. And also the latest data we received recently from the Office for Foreigners, from the beginning of pandemic, we noticed that there is a decrease in the number of asylum applicants compared to the same period a year ago. As we see, also only 74 people received their refugee status. The majority of people have received negative decisions, or their decisions were not finished. I'm sorry for this. Okay. But if we see from this diagram, the group of people who receive protection is not large, but it doesn't reflect the reality. Maybe I will tell in different way. The negative decisions, as we see here, reflects how extended is the group who remain in a long-lasting procedures here in Poland. Because during the all steps, all stages of procedure, they are entitled to stay in Poland and receive public assistance. And this group, as you see, is definitely very large. So maybe a few words about the rights and asylum seekers have in Poland. First of all, according to the Polish law, all of them as applicant, and also all people who are included in his application, have access to health services provided by now Petromedica company. Also, they can they are entitled to public assistance provided by accommodation in migrant centers, or also outside the centers. But as you see, the amount they receive monthly is really very small. So all these people are exposed to poverty, what enforces them to find alternative solutions. Unfortunately, it very often means that they start to work without any contracts, without access to social security. If we compare it to people who grant protection, and here we have, as I mentioned earlier, people with an international and national forms of protection, situation seems to be a bit better. While after granting international forms of protection, refugee status or subsidiary protection, each person is entitled for 12 months of individual integration program, and also can use from benefits such as cash benefits, also access to assistance, psychological help, or get prepared for fighting unemployment. But other forms of national protection do not guarantee access to individual integration program. Generally, all these people have access to labor market. They are entitled to the same permanent and temporary social benefits as Polish citizens, and also to the same healthcare services. But it's how the national legislation say. In reality, and we also try to highlight it in our project reports, all these people face numerous obstacles and find themselves in more vulnerable situation, especially in such aspects as employment, housing, or ability to obtain vocational training. Unfortunately, pandemic only unveiled insufficiency and weaknesses of actual system. Maybe a few words about general overview, how it started in European Union. If we look at EU member states and Poland, March was the most turbulent period when EU and also national authorities implemented first emergency measures in response to this outbreak. European Commission has proposed a temporary restriction on non-essential travel from third countries into EU area, and many countries announced state of emergency or epidemiological state, introduced also lockdown measures which directly or indirectly impact mobility, migration and asylum. So in NIEM, we decided to include coronavirus into our monitoring. We, after the discussion with our partners, we choose few aspects. Probably will continue to extend all these aspects we would like to monitor. So we focused on state policies. Also, we look at healthcare, the access to medical healthcare, and also COVID treatment in all countries. We focus on socio-economic impact, actually how the lockdown influence access to labor market or other aspects of refugees and beneficiaries of protection life. We also would like to focus on psychological impact. Actually, it's very a lot is thought about impact the COVID has on domestic violence and the situation of women and children locked down in houses. Also, we monitor what actions are introduced and who are the main actors in all countries. Is the main role in supporting refugees and migrants is on NGOs or social organizations, or it's governments or municipalities who try to intervene. So there are a few fields we would like to cover in our future research. And maybe now it's time to have a look at Poland. Everything similar to other European states started in March. At the beginning, epidemiological threat was announced. It was also the beginning of lockdown measures in different sectors. Firstly, there were schools, universities were switched into remote classes. Such sectors as gastronomy and services were almost frozen. It's actually had very big essential impact on employment of refugees and asylum seekers and migrants in Poland. Second main step was March 15, when Poland closed its borders to foreigners. And actually, according to the newest announcement, the borders remain closed till the middle of June. In the end of March, Prime Minister announced this epidemic state in Poland, and from the time further restrictions of movement were provided, and also it had an essential impact on the migrant centers, which remain under quarantine. Also, all migration and asylum offices suspended their face-to-face assistance. During the introducing the different measures, the government implemented the AntiCrisis Shield Act. There were three novelizations during the last 2 months. At the beginning, the act only included migrants. It's economical migrants. It's as this is a very essential and important issue for Poland. Refugees, asylum seekers, and generally forced migrants were not included into this document. Only the second novelization also included the asylum seekers. The document extended the temporary certificate of identity, which is the main document for asylum seekers during the procedure, and allow them to benefit from legal assistance and all other forms of public assistance. All documents are extended up to 30 days after the epidemiological state will be lifted. Still, situation is unclear as new documents, new IDs, or new residence cards are not issued. For example, when the person is granted refugee status during the pandemic, he or she have no physical opportunity to apply, for example, for integration program, so they cannot benefit from such kind of help during the pandemic. Also, migrant and NGOs organizations alarmed a lot about different difficulties that migrants face here in Poland. Although, according to the legislation, as I said, almost all migrants during the procedure and also with granted protection have access to medical assistance, and also during the pandemic, government announced that migrants who don't have insurance in National Health Fund have access to medical care in COVID cases. There is still a lot of obstacles, such as self-isolation and also quarantine in migrant centers. People are actually excluded from the ability to have contact with medical specialists or any other ability to have psychological assistance. Also, online psychological assistance is very limited, as majority of families do not actually have any kind of devices, computers, or just access to internet. So we can see here real importance, real problem of digital exclusion that appears during the coronavirus, and it concerns all categories of migrants in Poland. The other aspect that should be mentioned during the discussions on situation of migrants and refugees and beneficiaries of national forms of protection in Poland is socio-economic impact of anti-crisis measures. As I said, in March, majority of sectors were locked down, so people just leave the possibility to find employment, or their previous employment was terminated. The problem is that majority of migrants, also forced migrants, they do work in Poland on the basis of civil law contracts. Such kind of contracts do not protect them in cases of termination, and they has also very limited access to social security. The other aspect of social-economic impact is the homelessness, and as people lose their right to work, they also lose their incomes. That's why NGOs alarm that now many families, and there are also families with small children, are now exposed to homelessness. NGOs also started to provide in a large scale help delivering food and medicines, as there are issues that people could not just by themselves because of no work and no ability to have benefits. Lockdown also had a serious impact on access to education for children, especially children who live in migrant camps. As pandemic started, all schools were turned into online education, and it appeared NGOs found that in many cases families do not have enough devices for children, and also all educational materials do not include the specific needs of children with migration background. There is no assistance provided for such children now, especially in terms of learning Polish as a foreign language, and also meeting the requirements from compulsory subjects. If we try to think who is the main actors nowadays that help migrants and refugees and asylum seekers in Poland, we will find that actually in Poland, NGOs and social organizations are leading in responding to current challenges. There's also very interesting examples how municipalities try to involve in such actions. For example, municipal offices of Warsaw or Gdańsk provided websites in 4 languages, that it's more understandable for foreigners to get access to information, what's going on, what their rights, and how they can have access to help during the pandemic. Migrant organization also started various fundraising campaigns, as looking for computers for children, hygienic goods for women from the migrant center, delivering food packages. And also there's a significant role of migrants themselves and refugees communities who consolidate in aim to support their own members, but also they initiated social campaigns to support local communities, hospitals, care centers during the pandemic here in Poland. So it will be briefly overview how it's look like in Poland, based on what we are looking what we are focusing on our NIAM project.
Thank you. Is that the end of your presentation?
I think yes. If mentioning, maybe you have some further questions. We can.
Yes. So I would love to follow up now before we open up for Q&A with some follow-up questions to both of you. And you can decide who would like to respond to them. So some of these were prompted by your wonderful presentation. So thank you. It was really informative. I was curious about the political discourse in Poland more. I know yours is an EU-wide project, and Poland has really transitioned into having a stronger economy that now maybe is under threat. But how do you see, what is the political discourse in Poland around accepting refugees now, and not just asylum seekers, but around EU burden sharing? Do you see the questions about the discourse being connected to whether refugees or asylum seekers or the people you've taken have integrated, since your focus is on integrated? How do you see that discourse?
I may try to answer your question, but before I would like just to maybe ask Ksenia to move to the last slide of the presentation so that you can see the address of our website with the information about the project and the publications I mentioned at the very beginning. As for your question, currently I would say that refugees are very rarely mentioned publicly. Accepting refugees was a huge topic of discussion in 2015, 2016. So just before the parliamentary election of 2015, which the party which currently rules in Poland won. Just before this election, it was a huge topic, very controversial, and 2016, 2017, it was often covered by media in Poland, but currently it is very rarely mentioned. And probably it is, on the one hand, it stems from the fact that we in Poland, we do not have as many refugees as countries like, for example, Italy or Greece, France, and we have a relatively small number of acknowledged refugees, recognized refugees. On the other hand, current government is reluctant to open this debate. And also it is maybe worth mentioning that contrary to other EU countries, especially Western European countries, we haven't had in Poland we haven't yet had an open, serious debate on migration and refugees. We're still waiting for it, you can say. So currently, in the context of this pandemic, you can find in some Polish media information about the impact of the coronavirus on refugees, but usually these are reports from other countries. And as for a situation in Poland, we really have to look very deeply into details to know more, because it's in the current context, it's very rarely mentioned.
As you've been doing your project, then, I mean, what is your own ideas about Poland's contribution? Do you think that maybe your project could lead to a greater push or advocacy in Poland, that Poland could be actually housing, or taking in more refugees, asylum seekers? Do you think that there would be a room for growth of volunteerism, the role of, nonprofits to be able to advocate for a greater role for Poland in being part of, refuge around the world for people who've had to flee their homes.
Ksenia, would you like to answer this question, or should I continue?
If you can, I think it's a good question even for us. If we do our best to promote our results we found here and motivate the discussion, debate, and actually to involve also beneficiaries of protection to have their voice heard here in Poland. But I think it's a lot should be done as soon we will have any kind of results.
Maybe I should have, if I can add something, I should have said at the very beginning that our project consists not only of research, but also of advocacy activities. It is aimed also at changing integration policies, at improving them by providing decision makers with evidence on gaps. And apart from preparing publications which present results of our research, we also try to reach various stakeholders to organize in each country, including in the project, coalitions of different stakeholders, including public administration, local governments, civil society organizations, academia, and the beneficiaries themselves, to make possible a debate about different aspects of integration, which are sometimes omitted in the general public debate. So yes, of course, like we see space for improvement, and the aim of this project is also to improve integration outcomes, to change policies, to change general attitudes of the public administration, first of all, towards integration of beneficiaries of international protection. And as I said, we analyze this from various perspectives, including various areas of integration. And we can say that in some areas, Poland, I can say it's quite successful. In some other areas, we still see much room for improvement. And the idea of this project is to compare, but not to shame someone, but to show good practices and show, to inspire, let's say, each other.
Are there actually refugee-led organizations or migrant leaders that have emerged in Poland, and do you work with any of them?
Yes, they're also included in the work of the coalition, which was formed as a part of this project. We also plan to establish a council of refugees, so which will also be included in our advocacy work. There are several civil society organizations representing different communities. I am a co-founder of an association of Russian migrants living in Poland, some of whom are also in fact refugees. They're still in the process of applying for refugee status, but they also have this experience of being forced to leave their country. I could also name other organizations, but generally, yes, there are some organizations representing migrants and refugees, and we also try to cooperate with them.
I have just one more question, and then Janice is going to be fielding the Q&A. So if you have, I see there's a number of questions already there. And so then if you have your question, please pose it there. My last question just concerns the long-term problems that asylum seekers, refugees are likely to face you know, as a result? Has something shifted? It seems like you've been trying to do great work. So part of it is, do you think that this might set you back? You know, in what way has COVID setting you back in terms of the objectives or what you had hoped to have? And what do you see, you know, as some of the long-term effects of COVID?
Well, it is hard to say right now. It is something we would like to analyze. Probably this pandemic will, or it's hard to say, of course, how long the pandemic itself is going to last, but the measures to stop the spread of it may be still in place for next few months at least. So we also we will include this in our analysis, and as for now, it seems, for example, that education is an area in which this impact can be quite huge, because, as Ksenia said, all schools were forced to move to remote teaching, and not everyone, of course, not every family has computers and access to internet, and even if it sometimes can be that's only one computer for a family, and if also parents have to work at the same time, it means that children have very limited access to internet or these courses, and for people living in reception centers, it is sometimes even more difficult. So that creates this lockdown may create a gap, let's say, in the teaching process. That's one example, which, even if it's only a few months, it can have significant impact on integration outcomes in future.
Thank you. Yes.
We have about 9 minutes left, so I will ask you to answer these questions as briefly as possible so that we can get to many of them. What happens to refugees who receive a negative decision? Are they sent back to their country of origin? How many people are actually deported?
Thank you. It's actually a very important question right now here in Poland. As I mentioned previously, the law is implemented here in Poland day by day. So in majority of cases, Office for Foreigners, bodyguards have to work ad hoc. They don't have any rules how to proceed. So as we know, at least from human rights organizations, people who receive negative decisions during the pandemic also receive the new forms for application, because as soon as they apply this next time for protection, they can stay remain in Poland legally and also continue to receive the public assistance. The problem was that applications are in Polish, so people very often cannot do it by themselves. So we know that some of them ask for help in migrant centers. Some were also assisted by NGOs, but this situation is really very unclear, and there are more doubts than what we know. And also there are some cases of deportation. Unfortunately, it was not also officially mentioned by the officials and the bodyguard, but media's announced about at least 55 deportations that took place from the beginning of pandemic here in Poland. As we know, people are transferred to Russia, and then they are deported in most cases to Chechnya. So if I can.
Thank you for that answer. The second question is COVID-19 specific. Do you know of any cases of COVID-19 among migrants and refugees in Poland? And can you talk about their particular situation in terms of accessing healthcare?
As I know, and what we hear from different NGOs, so we know such indicated situations here in Poland. So it's hard to say if there are any cases in Poland, but of course we don't have access to all information, to medical information first of all, as also we cannot contact in majority of cases the people who stay in migrant centers.
Okay, this is a more general question. There has been a significant rise in anti-Semitic activity in the US as a result of the pandemic. Is there a similar pattern in Poland?
Ksenia, you wanted to say something, yeah.
I'm afraid that it's a general important issue in Poland in case of rising discrimination and xenophobia. For example, we noticed not maybe among refugees, generally among migrants. There were cases related to not allowing migrants, citizens from Ukraine to enter services, shops, and also there were different incidents related to people from Vietnam communities. Can you add something, Katarzyna?
I would like to add that I would say that this is a generally a very important serious problem which has risen in significance over the last few years, according to reports both by civil society organization, migrant organizations, and the Polish ombudsman. We have more cases of violence, for example, against migrants or people perceived as foreigners, and also anti-Semitism to some extent remains a problem to be discussed, a serious problem. But in the context of this pandemic, I don't think that it plays a significant role. Largely probably because borders are closed, and some migrants, for example, from Ukraine left Poland. They were forced to leave Poland, and I haven't heard of cases of violence toward migrants or such reports in the context of pandemic, but we hear, for example, of cases of not violence but distrust and against towards representatives of medical care. People became afraid of, although on the one hand we have actions of solidarity with doctors and nurses, on the one hand we hear of cases of, for example, people they fear that they will spread this virus, and there are also some cases of showing distrust and fear of people, and no suggestions, for example, that they should move somewhere else, that should be isolated because they may spread this virus.
I'd like to use my co-host privileges to ask the last question. There has been a criticism of the integration paradigm in the migration theory in the academy. because it creates this binary of, on the one hand, the migrants supposed to integrate, on the other hand, the supposedly homogeneous society that the migrant is completely set apart from. So when you are defining integration, are there any mechanisms that you integrate a form of feedback from who you call beneficiaries of your services to redefine integration? Or how are you defining and measuring integration? And is there a reverse flow of information from the migrant to those who design the policies?
As you're about to answer, that was going to be my last question too, so I'm thrilled. Thanks.
Okay, so in this project, we focus on the beneficiaries of international protection, so on those who are recognized refugees. And we use this category because it is universal for the whole European Union, and it makes it possible to compare integration in the selected areas. And so we use the officially acknowledged definition of beneficiaries of international protection. Apart from that, there are also other categories of protection, yeah, in Poland and also in other countries, but we focus on this particular group. And Ksenia maybe may add something if you think that I have omitted something.
Oh, no, I think.
No, but yeah. Generally, yes, we focus on this particular group.
Thank you. I want to thank you all, and thank you. My students this week in class are thinking very deeply about how we understand integration, and they've been reading about integration as markers of it. Housing, employment is also a means, and then more broadly, how that connects to national understandings, you know, of citizenship and nationhood, which is a lot to think about. I'm sure you will be when you're writing up your findings. Do either of you have any final words you would like to say before we close out the webinar?
I would like to
thank you once again. This is Ewa Kownacka from Poland. May I add something as a final word?
I'm sorry, but not right now. We're going to let the speakers. Can you write it in the chat? Thank you.
Eva is a member of our team, so I understand that she would like to say something as a researcher.
Go ahead then, sure. Thank you, welcome Eva. Go ahead.
Thank you so much. I just would like to refer to the final question about our approach to the integration. Although as a think tank, we treat integration as, as well as academia moves forward, as this binary and dividing concept, and not very up to date, and not considering the diversity of society, not only cultural, but generally omitting the differences. Within this project, all the indicators and the concept of integration, how we define it, is based on postulates or the key factors for integrations that are written in and recommended by international and European legal standards, both such as Convention Against Torture, Geneva Convention, and so on and so on. The whole list is available on our website. We can provide you with the details. So the model according to which we measure where the countries are is based on those documents, and but as the documents were signed and developed in very different sets of time, Very many of them, such as Geneva Conventions, are not very up to date and does not correspond with nowadays reality, such as climate change, for example, and forced migration and asylum seekers due to climate change. Then obviously we distance ourselves from this old concept. But, we tried to take the indicators from those documents, build up a model and check, even if it's not ideal as an integration concept, how far we are from this model. But during the works, we've seen that, the model that is, let's say, implicitly agreed, because people who countries who signed all those documents as partners should implement their aims. So it's accepted. Still, we are very far from fulfilling even this basic and outdated postulates. And the second thing, we as well noticed that the model that appears or arises from those set of European standards and international standards and normative documents is very incoherent. There are many, internal conflicts or discrepancies between what the states should do and how they should approach integration. So we're thinking as in our team more about inclusion and thinking about inclusion in the society and, migrants or asylum seekers as only one aspect of people's identity. Because, the asylum seekers are, I don't know, doctors, there might be people with disabilities or, people of different and diverse faiths. So not, to label people according to their legal status, but rather thinking about the heterogeneity in the society and, addressing the needs of all. So more through the lenses of equality, diversity, and inclusion. While unfortunately, within this project, we refer to what was officially written and signed by, within UN and EU, and checking that. Another thing is that based on what is going on, we try to, and as Ksenia mentioned, have this debate, internal debate, how to monitor and, how to, what kind of tool we should choose to measure the impact of the pandemia on vulnerable groups such as asylum seekers, beneficiaries of international protection. And as well, what we see is that, in some countries like Poland or Hungary, not the COVID itself, so the epidemiological threat and the lockdown is the most dangerous for asylum seekers and beneficiaries of international protection, but general fail of democracy. And that the government takes the opportunity to strengthen their power by implementing temporary or so-called temporary provisions, which we feel more and more might not be taken away or, loosened once the pandemic is over. So we would like to track it, and we would like to check how this stable legal reality from before pandemia has been changed during this temporary measures, or whether the integration and inclusion and addressing the needs of vulnerable people, especially asylum seekers and beneficiaries of international protection, has been dropped throughout the way because, the life and the virus are the most important and we don't care, or that the countries took care of those the most vulnerable and included in the group of vulnerable people, asylum seekers and beneficiaries of international protection. But it's still our internal debate.
Thank you so much. That was really informative. We're going to have to close out. We see that our participants are leaving. It was really helpful. Thank you to all our speakers. Thank you for those who've been regular part of our series. Thank you to my co-host Dennis, and to Danny and Cindy. This was ended on a very strong note, and so thank you.
Thank you
and
all.
thank you once again for invitation, for giving us this